Thanks so much for having us to talk with you today. My name is Katelyn Holliday, and I'm an assistant professor at Duke in the Department of Family Medicine and Community Health. And Perla Medrano will be presenting with me. She is now a clinical data manager at Duke Global Health Institute, but she worked on this study with me when she was a master's student at Duke. And I believe we also have Pedro Gomez Altamirano on the call, who is one of our team members that helped with conducting the study. She's going to check the chat. Okay. So today we'll talk about some things that we learned from the Women's Physical Activity and Community Study, where we learned about individual, social, and community environmental issues that make it harder or easier for Black, Latina, and white women to complete physical activity. We collected this data with the goal of using it to help us develop better physical activity programming for women in Durham. So we recruited women aged 20 to 40 from Lincoln Community Health Center and Duke Family Medicine Center to complete surveys and interviews. So this is just a snapshot of our survey participants. We recruited 129 women from 2020 to 2022. Half were between 20 and 29 years, and half between 30 and 40 years. 34% identified as Hispanic or Latina, 38% as non-Hispanic Black, and 28% as non-Hispanic white. Women were from a mix of income, educational, and employment backgrounds, and 40% were caregivers to children or other family members. 52 of these women went on to complete our interviews, including 20 Latinas. And the interviewers were from the same race or ethnic group as the women. So for example, Perla and another graduate student named Diana completed the interviews with Latinas. So one of the key community issues that women reported in our survey was fear of discrimination in public places. So we asked women if they worried about being treated badly or differently in several locations due to their race, ethnicity, or language. And here in this graph, we have those locations on the left and the percent of women reporting fear of discrimination in yellow for Latinas who participated in our study in Spanish, and in red for Latinas who participated in the study in English, and in blue for Black women. White women reported almost no fear of discrimination, and so we don't have them shown here. So this graph shows that at least 20% of Black and Latina participants reported fear of discrimination in every location type, with much greater percentages in many locations. So for example, 70 to 80% of Spanish-speaking Latinas reported fear outside of their home neighborhood and in interactions with the police. About 30% of our Latina participants completed the survey in Spanish, and these women consistently reported more fear of discrimination than the other women in the study. In the interviews, women shared many different individual, social, and community environmental barriers to physical activity. Many of these barriers were the same for all women, regardless of their race or ethnicity, and included things like self-motivation, lack of time, and caretaking responsibilities. So today, we're going to focus on the barriers on this slide that were specific to our Latina or Black and Latina participants. And while I'm sure many of these themes are not new to those of you on the call, many of them have not actually been widely documented in the physical activity scientific literature. And so we think it's important to highlight them. So in the interviews, women further described the fear of discrimination that they felt in public places. Here, Latinas discussed feeling afraid and knowing that there were areas of Durham that they would not go to because of racism. Several Latinas had moved to North Carolina from other places in the United States and felt that discrimination and racism were worse here than in other places. So for example, one woman shared that she felt she always had to be on alert here in the South and had experienced negative comments here. Another shared that she never felt safe away from her home neighborhood and described how a flag nearby her home, Confederate flag nearby her home, made her family feel unwelcome. Both Black and Latina participants described how their fear of discrimination kept them from using physical activity resources. For example, both Black and Latina participants shared that they were afraid to use some local parks, particularly in rural areas. And a Latina participant said that she wouldn't go to what she thought was the best local gym because it was not diverse and she felt judged and out of place when she went there. Well, groups of women discussed family obligations as a barrier to physical activity. Latinas more often describe this as part of an obligation to a greater cultural sense of duty to family. And both Latina and Black participants also described having friends or family discourage them from doing physical activity, often because their friends or family felt it was inappropriate for women to do physical activity, either due to safety or because of physical changes that might happen to their bodies. So, for example, one Latina shared that her mom told her she was getting too muscular and that it was unattractive for a woman. And another said that some Latinas are discouraged from doing physical activity by their spouses because there's a perception that they shouldn't need to be physically fit if they're already married. While all groups of women had some fear of crime and safety due to being a woman, Latinas tended to talk about this fear differently. They were more likely to explicitly talk about being afraid of men and were more likely to report experiences with and fear of public harassment like catcalling. And finally, while women from all groups had concerns about the quality and availability of physical activity resources like parks, sidewalks, and trails in their neighborhoods, women reported having even less availability in neighborhoods where Black and Latino families live. Now I'll turn it over to Perla for her part.
Thank you, Katie. We also asked Latina participants about their preferences for community-based physical activity programs. Next slide, please. Thank you. In the interviews, we found that nearly all Latina participants were unaware of local community physical activity programs. For example, one participant said, "I have not taken advantage of any community programs because honestly, I did not know they existed." Some Latinas felt they were less likely to receive information about local programs than other ethnic groups. One participant said, "Nobody knows about community physical activity programs. I have never been invited to a 5K in Durham before, being of the Hispanic population. I have only seen people of other races go to those types of events." Now, despite not knowing of local programs, most Latinas express strong support for community programs, particularly for community building and social support aspects. One participant said, "I think community physical activity programs are a good idea because then you have a community that you already know and trust that can also help you and support you in trying to be active." Most Latinas express strong preference towards women-only programs, likely due to the fear of men they expressed. One participant said, "Definitely like women of color, even white women, but I think the women part is the most comfortable part for me, especially for physical activity." Several Latinas also expressed a preference for diverse programs that are not predominantly white, with an interest in doing physical activity with other Latina women. One participant said, "In Durham, there are more Latinas, you know? So the Chain Gym was more of a community that looked like me. And so it felt less weird, more like I belonged. Where the community in Raleigh, it was very white." Another participant said, "I feel like it would be fun to see more Latinas working out together in Durham. I would feel more comfortable with that here because I don't experience that anymore, you know? We can relate." Now, several Latinas identified English-only services as a language barrier in group-based physical activity, and they expressed support towards programs that offer Spanish services. One participant said, those physical activity resources need to be available in Spanish. That would make it easier for a lot of individuals to be more committed. Several Latina participants described the challenges of doing physical activity as parents and their preferences for family-friendly programs. One participant said, finding someone to take care of my children is an issue. If there was a program in which you could exercise with your children, where they motivate both parents and children to exercise, that would be amazing. Now, several Latinas also expressed strong support for beginner-level classes such as yoga, Pilates, dance, and walking groups, and outdoor programs such as those held at parks. One participant expressed her preference for beginner-level classes, stating, it makes it easy to know that we are all in the same struggle, and probably more motivated to be encouraging to one another. Now, many Latinas identified a general knowledge gap related to physical activity, and they highlighted the importance for community programs to include health educational components. In fact, Latinas were the only women who mentioned the importance of incorporating health education. One participant said, I think just like the lack of knowledge, I feel like people know the benefits, but like not really. Just overall like education on health, things that are affordable, free, access, resources, kinds of things like that. Another participant stated, there should definitely be programs not just towards motivating people to work out. No, people need more than motivation, they need information.
So we have two goals for our next steps. The first is to develop community-based physical activity programming for women that addresses the barriers and preferences we learned about in this study, using organizations like Durham Parks and Recreation and the YMCA. And then the second is to develop a better screening tool to identify adults in healthcare settings who would benefit from increasing their physical activity. We could then use this tool to help doctors refer their patients to community physical activity programming, like what we're trying to develop. And we really need a better tool like this because the ones that we currently have don't do a good job of capturing all of the physical activities that people do, particularly job-based physical activities. And they haven't been developed with input from Spanish-speaking populations, both in terms of the language used and also thinking about the kinds of activities that they prefer to do. So we're happy to take any questions or comments that you all have, and we'd also love to ask you all some questions about our next steps. So our first question to you would be, what organizations or individuals do you think would be interested in advising us and working with us on developing community physical activity programming for Latinas? And then the second is, where do you think would be the best place to recruit Spanish-speaking participants to help us develop that physical activity screener? And just for information, those people would complete an interview, answer survey questions, and then wear a physical activity tracking device.